Oxygen is a gas that your body needs to work properly. Your cells need oxygen to make energy. Your lungs absorb oxygen from the air you breathe. The oxygen enters your blood from your lungs and travels to your organs and body tissues. Increased oxygen accelerates bone, skin, and muscle regeneration, helps the body fight infections more effectively. According to the American Lung Association, the use of supplemental oxygen for severe lung disease improves sleep, mood, mental alertness. Listen to this video, and if you find it helpful, please like, comments your opinions, and share to help others. Gets oxygen through open windows or get outside to breathe fresh air. Something as simple as opening your windows or going for a short walk increases the amount of oxygen that your body brings in, which increases overall blood oxygen level. It also has benefits like improved digestion and more energy. Food that gives more oxygen. To enrich your oxygen levels through a healthy diet, you should consume dark leafy greens. Leafy greens such as kale and spinach increase blood oxygen. Some potent antioxidant-rich foods that increase oxygen levels include garlic, dates, bananas, and carrots. Listen to this video, and if you find it helpful, please like, comments your opinions, and share to help others. Oxygen therapy may also include reducing breathlessness, increasing your ability to maintain an active lifestyle, helping to reduce stress on other organs. Lack of oxygen causes restlessness, headache, confusion, anxiety, rapid heart rate, tachycardia, rapid breathing, tachypnea, difficulty breathing or shortness of breath, dyspnea. Listen to this video, and if you find it helpful, please like, comments your opinions, and share to help others. Thanks for watching.
Now, we've all been told that getting more oxygen into our cells is a really, really good thing. So many diseases occur because of this lack of oxygen, whether it's ischemia, hypoxia, whatever. Oxygen is a good thing. So today I'm going to reveal the secret of how to increase available oxygen into your cells. And so you probably already know that sleeping with the window open is going to help increase oxygen. Maybe having more plants in your room are going to give you more oxygen. Okay. You also probably know that exercise will increase oxygen, specifically aerobic type exercise. That's the exercise that occurs maybe when you're walking or a slight jog. Being outside in nature will also give you more oxygen, right? I recently did a video and talked about methylene blue can give you more oxygen to the cells, which is pretty interesting. But there is a very interesting secret about oxygen that I'm going to share with you right now that you may or may not know about. In order to increase the available oxygen into the cells, the release of oxygen out of your blood cells, there is a trigger. There is this thing that controls it, and that is CO2. That's right, CO2. You see, you probably thought CO2 was a waste product, and it's not needed, as you're breathing out all the CO2. And by the way, when you're breathing out, an average person is probably breathing out, I don't know, maybe 25 to 75% oxygen. So it's not all CO2. You're breathing a lot of oxygen out too, because it's not being absorbed. CO2 is the key for the releasing of O2. And it's called the Bohr effect, Bohr effect. CO2 tells the body to release O2. And the way it works is that CO2 increases the acidity, makes things more acid, and then that loosens up the oxygen so it can then be released. Take a look at someone that is starving from oxygen, someone that is in a panic attack, right? What are they doing? They are hyperventilating. What happens when you hyperventilate is you're trying to get a lot of oxygen, right? But you're not getting a lot of CO2. What is the most common recommendation when someone is hyperventilating? Breathe in a paper bag. What does that do? That increases the CO2, allowing the oxygen then to go into the cells. So it might be a really good thing to actually buy an oximeter. You can usually get them as a kind of a pulse oximeter, checks your pulse rate and oxygen saturation. And normally it should be between 95 and 99. Okay. And we're looking at how much oxygen is saturated in your blood. And it's a pretty cool test, and it'll kind of give you a reading of what's going on And so in this video, I'm going to show you how to increase the oxygen and raise it up to 99 or even 100. And you can do this test on yourself. At first, when you think about it, it's very counterintuitive. We're going to increase our CO2 to increase our oxygen. Sounds weird, but it really works. Now, a couple ways that you can increase more CO2. Breathe through your nose versus breathing through your mouth. Yeah, that's right. Breathing through your nose gives you more oxygen. You would think when you're sleeping that it would restrict the air, which it does, and it would restrict the oxygen, but it doesn't. You'll have a much better sleep if you breathe through your nose. Now, this is not all about just increasing your CO2 100%. We need a balance of oxygen and CO2. Okay, all we're trying to do is balance it. When we're under stress, our breathing changes and we no longer balance the CO2 with the O2. We actually are getting more oxygen and not enough CO2 when we're under stress. And that's just probably counterintuitive when you think about it, but the solution is to increase more CO2. And you can do that by simple breathing as well, like slowing down your breath, okay, and balancing out the inhalation with the exhalation. There was one study, which I'll put down below, that they added more CO2 to this oxygen, and they gave this mixture of air to these group of people who all had hypoxia. That's a condition where you have lack of oxygen, right? And they all increase their oxygen saturation, which is really interesting. So you'll have to prove this to yourself to see if it's true, but you will find it is true. But by increasing your CO2, you can greatly help stress, anxiety disorders, panic attacks. You can decrease inflammation. You can resolve many times depression. You can increase your endurance with exercise. You can decrease symptoms of respiratory problems like COPD or weaknesses within the lungs from past injury. You'll even be able to hold your breath longer. So how do we do this? Well, the first thing you need to do is to do a test to determine something, to determine your carbon dioxide, CO2 tolerance, how well your body is able to tolerate CO2. And it's a very simple test, okay? And I recommend you do it laying down on your back on the floor, okay? All you need is some type of timing mechanism, some type of watch, and because you're going to just record the timing. So to do this, you're going to nose breathe, just only breathe through your nose. And you're just going to inhale and exhale 3 times with a timing of 3 seconds. So 3 seconds in, 3 seconds out, 3 seconds in, 3 seconds out, and just do that 3 times. Now, on the 4th time, you're going to expand your lungs and breathe in as much as you can. So that 4th inhalation is a very large inhalation. Now, as you time this next phase, you're going to be timing the slow, continuous exhalation of air from that inhalation. And so you're not going to want to hold your breath. You're not going to want to pause. You just want to slowly let the air out, and you're going to time it, right? And see how long that takes, but it has to be slow and continuous. And so you're going to record the time until you run out of air. Okay, so now that you do that, okay, if it's 20 seconds or less, you're in poor condition as far as your respiratory system, your ability to tolerate CO2, your stress is probably pretty bad. You probably have a low tolerance to stress. You probably have anxiety. You probably can't exercise for a long time as well. You probably run out of gas. If you're between 20 seconds and 40 seconds, you're in the average group, okay? So not really great, not terrible, but right in the middle. If this exhalation is between 40 seconds and 60 seconds, you're above average, okay? Not really good, but you're definitely right in that intermediate area. You're definitely above average. Now, if that timing was between 60 and 80 seconds, you are considered advanced, okay? You have good stress tolerance. You have good endurance. You're in pretty good shape. You can handle stress pretty good. If you're over 80 seconds, you are in the category of elite, okay? This is like an elite athlete. You have excellent stress responses, excellent cardiovascular